You are 35 weeks pregnant, mama, and things are really starting to get real. I'm Bridget Tyler. I'm a Lamaze childbirth educator, birth doula, and a mama. And if you're new to this week-by-week pregnancy update, be sure to subscribe to this channel so you can stay in the know with all the educational videos that are being put out about pregnancy, birth, and postpartum. Well, let's look at what's going on this week with you and your baby. Your baby is making enough surfactant in their lungs that will allow them to breathe air at birth. This is a big milestone for them, since this means that they are one step closer to being able to safely be brought into this world. Usually babies are around 5.5 pounds this week and about the size of a honeydew melon, but your baby might be measuring smaller or much bigger. Some mamas simply have bigger or smaller babies, and that is a variation of normal. Your baby's lanugo, that hair that covered their body to keep them warm in the womb, is almost all gone, and the vernix that's been developing on the skin is now thickening. Some babies are born with a lot of vernix and some are born with very little, but no matter how much your baby has, it is so good for them. After birth, avoid wiping it off or giving them a bath, and instead rub that vernix into their skin. In fact, a newborn bath can be delayed for a significant time after birth to help them keep their good bacteria that they got while passing through the vaginal canal to boost their immune system and build their gut flora. Most organizations recommend waiting at least 24 hours after birth to give baby their first bath. I personally don't bathe my babies for about a week after birth. I simply use a wet washcloth if they have any areas that need to be cleaned, like their hair or their genitals. Now, mama, as you're getting closer to birth, you might be noticing some Braxton Hicks. We talked about Braxton Hicks briefly a few updates ago, but if you need a little refresher, they are the practice contractions that your uterus does in preparation for birth. Some moms feel them and others don't. In this update, we're going to talk about signs of labor because some moms confuse Braxton Hicks with the real deal, and I want to save you that stress. False labor happens when contractions begin and then stop, usually when you're being more active after sexual activity or if you're dehydrated. These contractions should stop if you slow down, sit down, and drink water with your electrolytes, of course. They don't usually change your cervix, and by change, I mean open or shorten it, which if you're like, wait, what does that even mean? You need to take the Built to Birth course. It's not too late, and you will be so much more informed and empowered for your birth after working through it. But as I was saying, these practice contractions won't significantly change your cervix. Maybe a little bit, but especially for first-time mamas, they aren't going to do much of anything. True labor, however, occurs when these contractions stick around, even if you rest and rehydrate, if your water breaks or starts leaking, and if they are changing your cervix over time. If your contractions aren't stopping for several hours despite rest and drinking fluids, you should notify your provider and ask for next steps. Now, in preparation for labor, something you can start doing this week is practicing laboring around the house. This is a good one to do whether you're having a home or hospital or birth center birth. The longer you labor at home for, the less chance there is for unnecessary or unwanted interventions. My encouragement to you is to practice laboring around your house in the different rooms you have. In the Built to Birth course, I provide a cheat sheet with all of the different movements that you can do that helps open each level of the pelvis so that you are laboring smarter, not harder. You can use this list or your own movement ideas and walk around your house and find places to labor in. The bathroom, the shower or tub, the kitchen, the bedroom, the living room, on the couch, on the birth ball, on the toilet, on the stairs. These are all places and props that you can use to labor with in the comfort of your own home. The more you practice it now and envision yourself doing it, the more likely you will actually do it in labor. Mama, that wraps up our time together this week. I'll see you neek week in our week 36 update. See you there.